What's up, guys? So it's May 6, 2025. I'm almost done with medical school, just 1 week left. And before I left medical school, I just wanted to show one of my favorite places um, to come. And it's this place, it's this park, a few miles from where I live. And it's just another one of those places I like to come every now and then to clear my mind. It's a lot of good nature out here. So today was a pretty good day. I'm on my autopsy pathology rotation in medical school, and it's quite an intense experience. I want to talk about that a little bit. But today was a good day because there wasn't any bodies, no autopsies to be done, and basically they told me in the morning, I got there at 9 a.m. and they said, you should get lost, and if anything comes up, we'll text you. And so I did. I got lost. I worked out and swam, and then I had a cappuccino. It's a pretty good day, and but an interesting thing about loneliness and being in medical school is that when you're really busy, you don't really think about it, right? Because you're focused on other things. But then there's like days like this where you have a lot of free time, which is good. And you have a good time, but at least for me, there's always this, like emptiness inside of me, whenever I'm free, it's like, I wish I had somebody to share all of this with, So anyways, I could have just gone home early, but it's like, what am I going to do at home? I was probably just going to sit around, probably play some Fortnite or something. And so I figured I might as well make an update video on my thyroidectomy, which was more than a month ago now, and talk about a few other things too as an update in my life. And those other things are just, as a medical student, going into internal medicine, something that's been bothering me lately is artificial intelligence. It's been on my mind a lot, so I want to talk about that a little bit as well. But let's give an update on my thyroidectomy first. So April 3 was my surgery. Today is May 6. You can see the scar here. I haven't been using sunscreen lately. I mean, at all, because until like this week, it wasn't very sunny out here. But I feel like my scar is healing pretty well. There's a little bit of, it's not tender. It's very hard when I press on it. There's a little bit of swelling here. You can see that on the side here. No pain whatsoever. They started me on like 137 milligrams levothyroxine after I got done with the surgery. And so I've been on that, and I feel like the dose is good. But it might be a little bit too low because I have had a little bit of weight gain, like 7-8 pounds. And but also it might be the right thing because my exercise tolerance has gotten a lot better. Like before the surgery, I could barely run like a third of a mile, on the treadmill at like 7.8 speed without having to stop. But now I'm up to like at least 0.6 miles before having to stop at 7.8 speed, which still isn't good, but that's a lot better than before. And so my heart rate is lower than it was before, which is really good. And I think I just needed to do some more training to make myself, go up. And I have noticed that, I'm like no Arnold Schwarzenegger by any means, but I have been gaining some muscle as well, much more easily than I was before, and that's good too. So far, I feel pretty good about my thyroidectomy. Um, I don't regret it because I didn't have any other option. It's still better to have a functional thyroid than not, because I do have to wake up every morning to take this pill now. I wake up at like 4:30 every morning now. I take the pill and then I go back to sleep. Um, so I don't know. And it's just a constant daily reminder, that this is it now, like this is what your life depends on. I mean, and to be fair, if I stop taking the medication for like a week, 2 weeks, 3 weeks, I think still, I'll still be alive, at that point, but I'm dependent on this medication. But maybe that's a good thing, because all of us die, right? Every soul shall taste death. And it's a reminder to us all, to me at least, that this is, your life is, you live in this organic body, right? And sooner or later you're gonna taste death just like everybody else. And so that's, speaking about death, I guess the other thing I want to talk about is this rotation I'm on, which is autopsy pathology. And I don't want to get into too many details because, obviously I have to respect, our patients, but it's been an intense rotation. And it definitely makes me think about, death in a different way. So I had one patient who died by suicide and another patient who was a child. And, in medical school, all of us in like the first 2 years, in the first year, we have an anatomy course, gross anatomy, where we work with cadavers, right? But those cadavers, in preclinicals, they're like all gray on the inside because they're fixed with formaldehyde. Their skin feels like leather, and their face and hands are covered until 12 weeks later, when you get to that part. But with these bodies, they show up fresh, and so they look like they're just sleeping, when you take them out of the bag. But they're dead, right? And then it becomes obvious that they're dead once you start cutting into them. And I'm going to get a little bit graphic here, but once you start cutting into them and taking out all their organs, and once you, open the skull. So, I don't know. It's disturbing, how I was so disturbed on my first day on this rotation, but slowly but surely I'm getting desensitized to it. It's almost like you're losing a part of your humanity. But, seeing a human being cut open, something I've realized is that we're all basically just roadkill, our bodies. Because if you ever seen like a deer get cut open just on like a hunting video or just in real life, just on the side of the road, we don't look much different as human beings. Or if you've ever even like cut open a mouse, we're just bigger versions of that, grossly speaking. And so for me, what I got out of it is that as human beings, we're more than just these bags of meat, excuse the language. For me, it's it makes me, realize that there has to be some kind of soul, because like I said, at first the bodies look like they're just sleeping, but then once you start, manipulating them, in autopsy, it becomes obvious that, there's no life force inside of them anymore. And I even asked like the are, pathologists, how has this impacted you over the last, because you've seen a lot of these cases. That's what I told her. And she said the same thing. Like, she said it's really obvious that these are just vessels, if anything, the bodies I'm working with, and that's why I don't get very emotional anymore. But she's also seen like a lot of child abuse and things like that, and it's made her think about things like the meaning of life and whatnot. And I get that. Something which gives me a lot of comfort, and especially when I've seen so much death, recently on this pathology rotation, is Inna lillahi wa inna ilayhi rajiun, which means indeed we belong to God and to Him is our return. And that's, at the end of the day, that's just the truth. Like, to me, that like everything, at the end of the day, everything in this mortal world is not permanent. And I know that thankfully I didn't see any crazy cases like child abuse or whatnot, but I know that God is good, right? And those children will get their reward, after this life is over. I don't know. So, it's everybody has different thoughts on this. But I don't know. If you guys are still in medical school, I don't know if I would recommend this or not, because it really is, it's eye-opening, and it really, it makes you see death in a different way. Yeah. So the other thing I wanted to talk about was AI, artificial intelligence, because I'm going into internal medicine, and the reason I chose this as a specialty was because of part of the reason I chose this as a specialty was because of that intellectual side of it, because it has nephrology and endocrinology and rheumatology and gastroenterology and cardiology. There's so much to learn, pulmonology, and you get these patients admitted into the hospital with, I don't know, chest pain or shortness of breath or whatever, and there's so many different things it could be, and it's just fascinating, cracking that case, doing that investigation. Patients make you feel like Sherlock Holmes. I mean, not all patients. Some patients come in for other reasons that are more straightforward. And if you wanted to become a specialist in internal medicine, you could do that as well. And there's a lot of different career paths. But you see, the reason why I chose internal medicine, which is that intellectual side of it, might not be a good reason anymore, is what's been on my mind lately, because of artificial intelligence. Because right now, if you take a patient's history and copy and paste it into ChatGPT, taking out any identifiers or anything that's confidential, of course, it's going to give you a pretty good differential diagnosis. Not perfect, and you definitely should not be doing it right now at this point in time, but compared to like 5 years ago or whenever ChatGPT came out, it's really good. Again, not perfect, and all of the sources it gives you are garbage. So at this point in time, I'm not encouraging anybody, including myself, to use ChatGPT for clinical purposes. But if ChatGPT is at this point right now, in just the 4 years or so that it's grown, imagine what it'll be like 10 years from now, 20 years from now. Because when I started medical school, this wasn't a thing, ChatGPT, AI. And actually, I remember in my white coat ceremony for medical school, the person giving the speech to all the future doctors, including me, was talking about how much medicine has changed since her days, like how she used to record lectures on different devices, or had to like really dig through library books, to get the information she needs, and how we all have, this information on our phones. And, as a, 23-year-old incoming, was I 23? Maybe 22. I don't remember. I think I was 23, but as like a 23-year-old incoming medical student, um, I was like, okay, medicine has changed since your day, but your day was like a long time ago, um, which sounds really stupid now. But look now, it's only been 4 years, and we have this advent of AI, artificial intelligence. And so, anyways, the reason this worries me as a future internal medicine doctor or possible specialist is because, in America, a doctor makes like $300,000, and possibly more as a specialist. Whereas a PA, a physician assistant, or a nurse practitioner who has significantly less training makes maybe 150K. And so if, like 10 years from now, if a nurse practitioner can just input whatever they're thinking into ChatGPT and get a pretty good differential and pretty good plan, then we're still going to need doctors, but not as much, right? And hospitals will probably hire more of these nurse practitioners and whatnot instead of doctors. And so, we're still definitely going to have jobs, because they need people to, explain these things to the patients and whatnot. But there's no reason why a nurse practitioner can't, do that also, just, translating medical terminology, if that's going to be our only job. And so, it makes me worried about the job market, in the future. And this is definitely something which affects other specialties too, not just internal medicine. Radiology, they've been talking about this for a long time now, the risk of artificial intelligence to it. And I did my radiology rotation like 5 months ago and asked them about it. And they said, oh, we're not worried, but you can tell by their faces they're worried. And so I think like 20 years from now, 30 years from now, a lot of the jobs which require intelligence will be taken over or significantly changed by artificial intelligence to the point where human intelligence won't be as necessary. Like the formula for being successful since we were kids and since our parents were kids, which is to get a good education and become really smart and get some skills which can't be used by other people, like becoming a doctor. This formula won't be the way to success anymore, and I don't know what will be. Will it just be like trades? There was a South Park episode, I remember seeing not too long ago where Randy has to fix like I don't remember, like a dishwasher or something, and so they hire this like handyman, and the handyman is like this redneck guy. And he's like, oh, I'll come back in like 2 days because I need these new parts. And Randy's like, oh, I'll pay you $50 extra. And he's like, dude, this other guy's paying me like $100 extra. So, and so, in the future, will it be like that where, these trade skills are what make us money? I don't know. I don't know. I think where we're headed sooner or later is like a universal basic income, assuming that our politicians don't stay greedy, which I don't know if, how possible that is, but because as AI takes over more and more jobs, I think we're going to have a higher efficiency in our workforce. So like the things that are generated by, whatever that AI takes over will be the same, except human beings won't be doing it. And so I think it's only logical that one day we have a universal basic income where everybody has, some money. And we'll still be working like, but only like 20 hours a week, not 40 hours a week. And honestly, that's not a bad future at all. We'll have more time to spend with our families and, figure out who we are and, enjoy life, enjoy these limited, this limited time we have on this earth. But the thing for us, because it's not a bad thing, but the bad thing for people like, you and me is that we're in this transition period where AI still isn't a thing, but in 10 or 20 years it will be. Probably more like 10 years. And so, for me, it's like I've sacrificed so much of my life, and I grew up kind of poor, not poor, but, lower middle class, with dreams of, becoming a doctor and having some stability, financial stability, and not worrying so much about, money, as I have been for the last, 27 years of my life, since I've been alive. But I sacrificed a lot to get to this point in my life. I feel like I've only been studying for like the last who knows how long, and I've incurred so much debt too. I'm like at least $200,000 in debt, and so with AI posing a risk to my job security in the future, I don't know how to feel about that. But I do know that for society as a whole, it'll be a good thing. Hopefully. But then also there's this other side of AI, because I've been talking to people about it, where like if you talk to people who have kids or like teachers and stuff, they're worried about it because kids can just, nobody knows how to write things anymore. You can just ask ChatGPT to write things now. And homework isn't a thing anymore. And so we are getting this situation where society is dumbing down, right? And so what does that entail for the future, really? And really, we're already seeing it. It's like the way that we used to learn things. American history or U.S. history or government or whatever. If people aren't really learning these things anymore in high school, if they just cheat on everything with ChatGPT, then what does that entail for our future when we have a bunch of uninformed, uneducated people making all of our decisions? And we already have that now, but much more of that in the future. And maybe we're just overreacting. Maybe I'm just overreacting. Maybe because people still can't cheat on tests, right, in high school, and so people still need to learn things right now. But I don't know what this entails for society in the future, but yeah. And so AI is a confusing thing, but it's like it's the future. Maybe I'll watch this video one day and laugh like you were way too worried about this, and maybe not. But yeah, it's just something that's been on my mind. So I don't know what your guys' thoughts are on this. I would still choose internal medicine, I think, if I could go back. But I was doing an ENT rotation a couple weeks ago, and I hated it. Otolaryngology. Especially as a medical student, because you just don't do anything in the OR. I hate waking up in the morning. I'm not a morning person. So, surgery has never been a passion of mine. I mean, it's kind of cool to watch, but there's way too much sacrifice that goes into becoming a good surgeon. But, with my increasing concern for AI, I have also had this side concern of, should I have done something more procedural, So I don't know. So, yeah. I'll just show you guys this. And I feel better already, just being out here. So anyways, you guys have a good one. And if you have any questions about this thyroidectomy, just let me know. One thing I forgot to talk about was a low iodine diet. I started that a few days ago, and it's kind of annoying. I'm on like this almond milk or whatever. And, I can't have any dairy. I can't have any chocolates. I can't have any eggs, which rules out so many things, I can eat. But I'll talk about that some more once I start the radioactive iodine therapy in a couple weeks. But let me know if you guys have any questions about that as well, because I know it's not easy to go through for everybody. And I've been lucky, I think, in how easy I've had it for the last few weeks. So, all right, you guys have a good one.